What's the Bahamas doing in the fight against COVID?
We're empowering Bahamians with free testing, free masks, and access to doctors for answers to your questions. Vaccines and boosters are saving lives. We have tighter restrictions at our borders, and we're expanding hospital capacity and hiring more nurses and doctors. We're taking on COVID while reopening schools and keeping our economy moving.
Together, we're moving forward.
Colleagues and those joining us via the stream, it is a pleasure to welcome you to the Office of the Prime Minister's weekly press briefing. This is going to be an abbreviated briefing, but still giving you the information that you need to do the jobs that you do so well. Today we have two guest speakers. I'm going to introduce the first right now, and that is Dr. Danny Davis, who is the co-chair of the Vaccine Committee, just to give you some updates.
Thank you and good day. Good day, Bahamas. Good day, press. Just a few quick updates with regard to the vaccine distribution numbers. To date, we have 51.3% of the eligible population in the Bahamas fully vaccinated. Of that number, 46.2% of them are the males and 51.7% are the eligible females in the country, giving us a total of 165,837 persons fully vaccinated in the country. With regard to persons vaccinated who've received either one or two doses outside the country, that total amounts to 7,272 individuals. When we total them together, that gives us our 51.3% of eligible Bahamians fully vaccinated. With regard to first boosters have been available for a while now, and up to this date, 28,961 individuals have taken advantage of the opportunity to get a first booster. That only represents 17.5% of the eligible persons for a first booster, so we are encouraging individuals who've received their second dose of Pfizer or who have received their first dose of Johnson & Johnson to come out and get their first booster shot. As of the 8th of May, second boosters were available to persons in the Bahamas who are over the age of 50 and who have received a first booster and want to avail themselves of a second booster. At this time, our main center for vaccination distribution within New Providence is the Mall at Marathon, and that is supported by Elizabeth Estate Clinic, Fleming Street Clinic, Flamingo Clinic, and also South Beach Clinic. In the Family Islands, vaccinations are available at all the local clinics, and in Grand Bahama, the Susan J. Wallace Center, Community Center, still operates vaccines on a daily basis. And I think that's it in regard to an update on the vaccine distribution numbers in the country. Thank you.
Any questions for? Well, I have.
Okay, we'll go.
Okay, sorry. Of those numbers, can you speak to how many of them would have been Johnson & Johnson?
To date, we have about 17,000 would have been Johnson & Johnson across the country. So Johnson & Johnson is the minority of shots administered. Pfizer, definitely the largest volume of shots have been Pfizer shots, followed, of course, by AstraZeneca. And those are the only three vaccines that we've had available in the country: Pfizer, AstraZeneca, and Johnson & Johnson.
Do you know the ratio, I guess, for the children in the Pfizer category? Can you give us some numbers in that regard?
Let's be clear with regard to children. We're talking now individuals between 12 and 18, yes. So I've been classifying them as the minors just to make that distinction between the two. Off the top of my head, I don't know the exact number for those. Sorry, I just don't. I can get that number for you, but I don't have it at this time. And of course, you know that even though there's a vaccine available for 5 to 12, that is not yet available in country, so we have no vaccinations within that age group.
Timeline as to when that vaccination will possibly reach the country, because I think parents are really concerned, and that's why we're actually seeing the breakouts in the schools at the lower levels.
I actually don't have a date on the vaccine arrival times for the pediatric doses. Unfortunately, I don't.
There was a vaccination incentive program introduced last year. What is your assessment of the extent to which that accomplished at schools, and is there any consideration now being given to having an additional incentivization program?
We've had a number, I don't know in particular which incentive program you're referring to, but we've had a number of programs, and I'll just briefly say that those programs didn't have the type of response that we wanted, but what it showed us is that with education, individuals will avail themselves of the vaccine. So rather than trying to incentivize, we've been trying to focus on educating the public as to the benefits of engaging this vaccination.
So we shouldn't expect any program where money is offered, for instance, to encourage people.
I don't want to be too presumptuous and to say what the future will bring for us, but we know at this point right now we're trying to focus really on educating the public as to the value of this particular step and why they should engage the vaccine.
Why do you think the percentage of the booster shots are so low? People are reluctant to go and get the boosters.
Well, I'm gonna answer that question in a different way for you in terms of why the boosters are so low. What we have seen, we did a survey of persons coming in to get a first shot, and what we've recognized is that individuals have been availing themselves of the first shot for primarily reasons of employment and reasons for travel. And so right now, the boost is not a requirement for either one of those events. And so we think that contributes to the lowering of the response that we've seen from the boosters. But in essence, we shouldn't tie the vaccination to an event like a travel event or an employment. We really should be looking at this as a public health incentive so that we're all in a better position moving forward.
Piggyback off that, globally there's been a drop-off in vaccination rates. What do you think the rate has been like here locally?
Locally, we've definitely seen a decrease in the number of vaccines administered on a daily and a weekly basis, without a doubt. We're consistent with the trends that are seen across the globe right now.
What are the numbers like in the fall-off?
I don't have a number on the top of my head, right at the tip of my tongue for you right now, but I can say to you, yes, we are doing fewer shots of first dose, second doses, and boosters per week than we were doing, 3 months, 30 days ago. Yes, for sure.
To piggyback off that, how are the numbers in the Family Islands looking now?
The Family Islands are holding their own. I really commend the clinics and the nurses in the Family Islands. They've been offering their vaccines through their local clinics. They've been advertising it locally. People, they're coming out to get their shots. The Family Islands have been doing well, in fact.
Given the fact that you've seen a drop-off, a concern last year was some of the doses were expiring. Can you say definitively today if we if we had some expire, how many have expired, and what doses are reaching the expiration date?
Currently in the Bahamas, we only have Pfizer available. At the rate at which we are consuming vaccines, invariably, if that doesn't increase, I think we will see once again we'll be faced with having vaccines, doses that would have expired, and we would stop administering those doses.
When do they expire? What date?
There are a few batches that we have there are 2 batches that we have in country, and one expires at the end of May and the other at the end of August.
How many vaccines would be in that expiration?
Unfortunately, I don't have those numbers in my head to say that it's X or Y. Only Pfizer we have in country, so it's only going to be Pfizer that's expiring because that's the only thing we're administering
You said at the
today.
end of May and at the end of August?
Yes.
Okay.
Any estimate of how many vaccine doses have expired in the country?
No, I don't have an estimate of that, but I can confirm that yes, we've had doses that would have expired.
Sorry, just to be clear,
Just to be clear, give me one question at a time.
just to be clear again, when you say batches, that'd be 2 batches, but we would still have vaccines after August that would be, I guess, usable?
Yes, the Ministry of Health is making a conscious effort to ensure that we always have vaccines available for the public. So while a batch may meet its expiry date, we do ensure that another batch is in the wing ready to take over. When your milk goes bad in the fridge, you purchase another one before that date, hopefully. And we're doing the same thing to ensure that the public always has available to them the vaccines that are required to ensure that the public health response that we want to see as a result of this vaccine is in fact present and available.
What's being done with those expiring vaccines? I know early in the year we saw us trying to give them to countries more in need of vaccines.
Let's correct that statement, please. There has been no attempt to give vaccines that have expired to any other country. We did make an offer to other countries in the region, etc., to have them receive the vaccines prior to expiration so that they could take advantage of them. So, just to be clear. Okay. All right.
Are officials satisfied with the level of vaccination for other issues? I think some people might be concerned that the rhetoric surrounding the COVID-19 vaccine might impact the vaccination rates for other illnesses and the like.
I think you may be aware that last week or the week before, there was the Vaccine Week of the Americas, where you saw a push for those childhood vaccines, and efforts are underway to increase the uptake of those childhood vaccines as a result of the lag from COVID, yes.
I know at the vaccination centers, you can also get the flu shot.
That's correct.
How has the uptake of the flu shot been as we tried to vaccinate against COVID-19?
Unfortunately, I don't know the uptake on the flu vax shots at this point. I can't say. But we have been offering it to individuals, yes.
What percentage of a lag have we seen for those other routine vaccinations in the COVID era?
We do know that there is a decrease, but I can't say to you if it was X% or Y%. I don't have that number at my fingertips.
Okay, so there's no incentives being given people to go ahead and vaccinate. So what's being done? You're just asking people just to go ahead and...
I think this conversation helps as well. As a part of the education, as a part of letting the public know what the status is today, ensuring that we're aware that, we do have vaccines, they're available. Where are they available? I've mentioned to you that we have the mall in Nassau that runs 10 a.m. to 6 p.m. Monday through Saturday. We have the Susan J. Wallace Center in Grand Bahama. We have all of the clinics in the Family Islands. We also have Flamingo, Fleming, South Beach clinics. So we're saying to the public through this medium that vaccines are available. And so we're dependent on this dialogue to help that outcome.
Dr. Davis, can you speak to people taking COVID tests as well? And my more specific question would be, I would have encountered a resident who went to the Malia COVID testing site last week, Friday. She met 3 cones. She had her booking, had her electronic booking, and there were 3 cones across Malia as if they were closed. Is there a situation happening particularly at that site where patrons aren't being informed of early closures with respect to COVID testing?
No. As you may be aware, last week we did have an issue with the platform. The vaccine platform and the test platform are closely related. And as a result of that downtime that we had, a press release was published to indicate to the public that the site was down and we would not be able to administer vaccines or tests until such time it was repaired. And once that situation was rectified, we issued another statement saying vaccines and tests are now available. So if your person would have presented at the time when the system was down, yes, on Friday there was a period when they would not have been able to get it. But we were back up at the end of the day. We ran on Saturday as well at the mall. So yes, these things happen. And I would say to you that I don't know if you can recall, but you can try, we haven't had any significant downtimes from we've started the vaccine and testing distribution, and that has been part of our success. It has always been available, and I must admit to you, last Friday, we were down for 1 or 2 hours that these things happen.
Last week, we also saw the CDC release the information on the Johnson & Johnson vaccine regarding the blood clotting issue. Have we seen, one, any cases of that here in the country, and two, have we seen any fall-off in vaccinations since that has been released?
I don't have the medical background to speak to the medical implications around the CDC statement. But in terms of the falloff for the vaccines, because we've seen a gradual decline in the number of vaccines, and we're not offering Johnson & Johnson, we can't say that any decline has been attributed to that statement from the CDC.
Are there any plans to bring Johnson & Johnson back into the country?
If there's a demand for such a vaccine, I think we will put the effort in, but there's no indication today that there is.
So the demand has just been, right now, Pfizer's been the high demand.
Pfizer's definitely been the highest demand vaccine that we've offered.
Thank you.
Okay,
Thank you.
great.
Okay. Thank you.
I know I said an abbreviated press conference, but those were some rapid fire questions. I do have a statement here by the Ministry of Health and Wellness that I will read, and then we do have Dr. Swan on hand who will answer your questions. I'm not sure if there are any left after that one. The Ministry of Health and Wellness confirms that there are several schools in New Providence have reported positive cases of COVID-19 among staff and students. As of May 10th, 2022, 38 positive cases were reported over a 4-week period via molecular testing, that is the RT-PCR test. These cases were dispersed over a number of schools and represent a small portion of the overall COVID-19 caseloads. The ministry also confirms that no clusters have been reported within schools in the Family Islands. While these numbers do not reflect an outbreak in our community, the Ministry of Health and Wellness maintains that it is imperative that individuals continue to strictly adhere to the standard of health and safety protocols, that is hand sanitization, and we all know the protocols, and the appropriate wearing of masks, especially in close quarters, and to isolate if you do experience any symptoms. The ministry wishes to further advise that contact tracing is an integral part of investigating cases and their possible linkages to others, which allows for the activation of isolation and quarantine measures. With regards to school operating, the Ministry of Health and Wellness supports the accepted processes, which involves making recommendations to the Ministry of Education, Technical and Vocational Training as it relates to permission for and conditions under which schools are to operate during a pandemic or other health emergency. The ministry wishes to underscore the importance of strong relationships with schools and its surveillance unit for contact tracing in guiding decisions to manage potential health challenges related to infectious diseases, such as decisions have both academic and psychological consequences on the nation's youth. That being said, the Ministry of Health and Wellness has not recommended closures of any schools during the past several weeks. And of course, Dr. Davis spoke at length about vaccines, so we do want to encourage those who are eligible to take the vaccine to do so. Do you have any questions for Dr. Swan?
Yeah.
Yeah?
Yeah.
Why has the ministry not recommended any closure of schools, sir?
Good day.
Considering?
Yes, considering what exactly?
Considering the cases in the schools now. Clearly, they're growing. Why has the ministry not recommended?
So we have reported over the last several weeks a gradual increase of cases in the community. Populations in the schools are part of the community. The numbers of schools that we have, a number of cases rather that we have experienced or been reported from schools are not to a threshold where we feel the school needs to be shut down in order to control anything, because there's no outbreak or anything in the schools.
Right. But generally speaking, we have seen a recent rise in COVID cases generally.
Correct.
Are you able to provide some insight? Are we seeing another surge? Exactly what's happening as it relates to the COVID situation in the country?
Right, so there's a surge, a number of cases are occurring, but it's not to the threshold where we are too concerned because it's just cases. If you look around the globe, we've moved away, or public health has moved away from the reactive posture of when there's an increase in number of cases, you automatically shut down. There are some things that other aspects of the monitoring process that we take into consideration. And for example, the hospitalization ability for us to determine how to manage persons who are positive, whether they're overwhelming the healthcare services, as well as persons who are even presenting to hospital for care, or I should say who are marked as positive in hospital or hospitalized cases. What is the spectrum of their illness upon presentation? Are they presenting to hospital because they have COVID, or is the COVID hospitalization number going up because persons who present to hospital for other services have tested positive for COVID from a screening perspective?
So that's the threshold that you're talking about. What exactly is the threshold? So it's not the number. You're saying what? It's the level or degree of the illness?
Right. So we usually respond to the burden on the health system to respond to managing the number of cases of anything that shows up on the doorstep. And at this point in time, and as has been reported by our numbers, we have 0 persons who are actually in hospital requiring advanced care. And the majority of the persons who are in hospital, who are on the hospitalization list, actually are there for another reason and not because they are ill with COVID.
What are health officials seeing as contributing to this recent rise in cases? Is it travel? Is it the events industry opening up? Is it kids back in school? What exactly are you seeing?
We're seeing it, basically we think it's more related to COVID fatigue. There are persons who are pushing for mask mandates to be removed, and some of them are just going on the way and moving those mask mandates themselves. And so the reality is that we strongly believe in science, and science has proven true. If persons are wearing their masks when in close confines with other individuals, whether or not they know they have COVID, because you really don't know, we feel that that is a protective measure, as well as hand sanitization. We have relaxed to some extent based on other indications, and again, globally experienced, about the physical distancing, so from 6 feet to 3 feet, and then even closer allowed in classroom settings.
Would you not say that it's contradictory though if some hotels are allowing their guests not to wear masks and then they come out into the community?
So bear in mind now that we have removed the mask mandate for wearing of mask in the community. You are allowed to be outdoors, allowed. We do not require you to wear a mask when you're outdoors if you are more than 3 feet from the person next to you. So that is where we are with that. And I think where the hotel system situation may have an influence is where the workers in the hotel are interacting with guests who are not wearing masks, and therefore are picking up the guests aren't wearing masks and hotel workers aren't wearing a mask. And so there's a risk for transmission. Not that we have highlighted that as a concern, but that's a potential.
I know you have obviously mentioned too that people who have COVID are not requiring hospitalization.
Correct.
Could it be that it seems that most of these people are fully vaccinated? Do you find that most people who have COVID now, in this particular instance, are vaccinated people as opposed to unvaccinated people?
So even though we've strengthened our data in that area, we still have not had the complete confidence to correlate the number of persons who are vaccinated with those who are testing positive. But we do know that persons who test positive who are vaccinated have a easier course with the infection. That also being said, whereas we would like to say, yes, we have a lot of persons vaccinated, that's not actually the reality. I think our vaccination rates are, 50, 51, 52%. So that's not the levels we would like to be at. Because if we get to higher levels, then we could talk about, the mask mandates. We can talk about relaxing some other things and just moving away from this pandemic phase into an endemic phase where we just, track persons who could become positive. Sorry.
Do you think the numbers that are being reported are true reflection? Because we know there may be instances where persons may take a rapid antigen test, they test positive, they know it's positive, and they know to isolate. Is health officials confident in the true numbers that they're seeing?
So we're confident in our reporting process. We've had this process from day one, and we are not about to adjust it because it now changes the way in which we are managing the system. We do have an indication of the number of positive cases that are from the rapid antigen test, and that is taken into consideration when we make our determinations and we look at our trends.
So when you say y'all have an indication, the indications is coming from, I guess, the government facility with the rapid antigen or private facility?
So every lab that is given permission or who is registered with the Ministry of Health to produce or conduct rapid antigen testing signs an agreement to report to the Ministry of Health via a platform. And so we receive those reports and we take that information into consideration.
So there is any consideration to integrate the rapid antigen into the reporting system so that we can have a true reflection of the...
Again, we are willing to maintain the way that we have continued to report. And that is because you need to ensure consistency across pandemics, across reporting waves, across surges. You can imagine that if you add a different flavor to what you have been doing before, it paints a different picture. And it is inconsistent with not just your definition of reporting, as well, but also as into what is accepted globally.
Okay, just in 2 weeks, we're going to have a carnival event,
Correct.
carnival-related events. Obviously, the Ministry of Health has given approval for that to happen. One, we wanted to ask what went into, I guess, telling health officials, I know they're going to have protocols in place, but that would be a safe event given the fact the pandemic is still happening. And then we see this rise in cases. Second part of that question is, they had said that the letter of approval was 500 people, but they're saying that it was a typo and they want to have 1,000 to 1,200 people. Are they going to be granted permission for more than 500? And then what went into approving that event? Is there any concern given that the cases are rising?
Okay, a long question.
Sorry, that was very loaded.
It's loaded, but I think it's a good question. And I shouldn't say it's a good question. It's a relevant question to where we are. I think what we are trying to get across to the general population is that there is a measure of social responsibility that is required. We have experienced the pushback, the outcry from the public about being, quote unquote, under lockdown and, quote unquote, losses associated with that, whether it be through interactions with others, finance, just basically the ability to socialize. And so when we make our decisions and we take into consideration the applications that we receive, we take into consideration the promises, I guess you can say, the statements that are made by individuals in their applications. Bear in mind that whenever we approve an application, that application is sent to, the approval is copied to the COVID Enforcement Unit of the Royal Bahamas Police Force, as well as the Department of Environment and Health Services, to ensure that those measures are taken into consideration as well as adhered to. So when we talk about this road carnival, right? That's scheduled for, I think, next weekend. The route is between Arawak and Goodman's Bay, or Saunders Beach, one of them. It's about 2.5 miles, about 5 kilometers, 3 something, whatever. And the number was 500 that they applied for initially. They applied for 500. I say it because they said it. They applied for 500. Actually, they approved for 300 to 500. We were generous and gave them 500. We don't make typos on those type of applications. It might be addressed to the wrong person, but it ain't gonna be the wrong number, right? And I say wrong person, I mean you might get it in your email, but it's some other event, not wrong person that way. But the other thing is that we have received their application for an increase in the number. And we have considered it, and I think since we haven't written them back yet, I wouldn't disclose what the decision was. But in taking into consideration, it's an outdoor event, and that's going on over a long period of distance for, say, 500 to 1,500 persons. And we've looked at other events that we would have approved in smaller confines, getting, say, that static, and make a determination as to whether or not we feel this event is substantially more risky than the other event. And again, the approval to have the event is just that. The approval to have the event is not a waiving of any of the public health measures that we've asked persons to adhere to, coming back to individual responsibility. You are saying you're going to this event. I'm sure you're not going to this event to catch COVID. So I would hope that as you go to this event to have fun, you would take some measures to protect yourself from contracting COVID and carrying it home to your relatives or carrying it to your workplace to infect your coworkers.
There's been some talk, there's been some talk about there being a new subvariant of the Omicron variant of COVID-19. Do you suspect that we have that in the Bahamas, and is that something the ministry is going to test for?
Well, we do routine testing, right? So every 3 months, we take our samples and send it off. I shouldn't every 3 months, but every 3 months. When you get a sample back in, we send another batch off. It takes about 2 to 3 months for us to get those results back. So I'm thinking that we would have sent samples off in a reference lab and so waiting for those to come back. There is a new variant that has been sweeping across Europe. I think it's now to some extent about 30 to 40% amount of the cases in the US. And, earlier on, some of y'all kind of young, right? But not the camera folk. But when they said the US sneeze and we catch a cold, literally that's what it is. And so it takes a while for it to get here. So we won't labor under the delusion that we won't have the variant whenever it comes. The variant has been seen to be a little more infectious than the other, but the course of illness is not as dangerous or deleterious as it was a Delta wave. And so again, you're going to catch something, or it's going to pass through. And so it's just a matter of trying to put in the measures and adhere to the measures that are going to prevent you from contracting the virus.
Just suspect that it's here now.
I don't know. I mean, I can't say it's not here or that it is here. It's not something that I want to do. This gentleman, please.
Say, I think last week, that most of our cases are imported. At least at March, not most.
Right, March.
Much of our cases are imported, and you just said that primarily it's over COVID. It's due to COVID fatigue that increased. So it's
correct.
Imported cases.
So the cases. Okay, when you say imported cases, these are persons who would have tested positive, and our examination of their, when you contact trace them, they would have traveled in the last 14 days into the country. And so they're counted as imported cases. That number or percentage of persons that are testing positive has decreased gradually over the last 3 to 4 weeks. It's, I think, at the level of 30 or 40% as opposed to the 50, 60% that we were seeing at some point in time. So again, the challenge is someone comes into the country, and again, and the data is not as tight as we want it to be, so we just use it as a marker to make a determination as to what is happening amongst those persons who are traveling into the country. But when you say imported cases, for example, we had about 63 cases last week that were quote-unquote imported. Measure that against the tens of thousands of people that are coming into the country. I think that number in itself is not one for alarm, but it's just something to keep in mind. And we are trying to find out exactly as we move forward which industries our local persons are working who are testing positive.
Are you able to say how many people are testing positive by way of the rapid antigen test? I know you said that officials would have received some indications from the various testing sites. Right?
So that number changes, and that's the reason why we don't report that number, because it's very variant, and so the answer is no. I won't say how much it was last week, because when we looked at it last week, it was one number. I'm looking at it again this week for last week, or the week before last rather, it had increased significantly.
I know that, we have COVID fatigue, but people also think about lockdown fatigue. So
correct.
People are seeing the numbers climbing
right.
slowly,
right.
but surely. Is there any chance that health officials would ever recommend another lockdown if the numbers get high enough?
Well, I never say never. And again, I like to dial it back to the numbers. The numbers that I'm guessing you're talking about is the number of positive cases. We are talking about the numbers in hospital. That is the measure for what we are trying to, what we use to measure our type of responses. How well is the health system able to manage the cases? If you were to start counting accurately the number of flu cases, for example, numbers might look astronomical, but that means we lock down the country. So it all depends on what is the impact of that infection on the individual, which reflects on how they seek care at our facilities.
Now, U.S. experts are predicting that going into the fall season that they can see uptick in cases. I guess, like you noted, the US have the US sneeze, we get your cold. I guess what is the health officials are doing to ensure that we prepare ourselves just in case that we go into the fall and we have another wave?
So a number of measures have been taken into consideration or into motion, I guess you can say, and that is one, making sure that the hospitals are prepared. We are presently finalizing the repairs to the extension, but the field hospital for the management of COVID cases. Once they get to hospitalization, I think the SPU has just been temporarily re-erected while we make some repairs to the legacy unit. And this is just to make sure that if we need to use those spaces again, we are prepared to do so. And so the Grosvenor Close, I think, has about 40 to 60 beds that will be available, and a number of them will have the capacity to manage ICU patients. So we are preparing, and not necessarily just for COVID, because we don't know when the next infectious disease outbreak is going to happen. And we need the facilities to make sure that those persons are managed away from persons who do not have infectious disease.
Can you say if health officials have been pulled, I guess nurses, doctors are being pulled from the system for infection as we have an uptick in cases?
We haven't received any recent cases, or recent report rather, about a burden of trying to find persons to come to work. But I'm sure if it happens, we will hear about it. But we haven't heard anything recently at the ministry level. It may be something that's happening at the institutional level that's been managed there where it should be, but at the ministry level, we're not necessarily having that cry that they're having challenges.
In that same vein, is the hospital then operating just normally right now?
I think that was the last release that they were back to regular services.
Thanks.
All right.
And after this, I am certain that you don't have any other questions, but I do have some announcements to give you, and then we will wrap up for the day. The first is on testing. So since beginning our free testing pilot program on January 8th, there have been 80,123 tests administered in New Providence and 7,256 tests administered in Grand Bahama. Over 80,000 tests conducted in New Providence, a total of 1,280 tests were positive, and over in Grand Bahama, of those 7,000 tests that were administered, 54 of them were positive. Testing obviously remains a vital tool in our COVID strategy, so we encourage residents to continue to test, especially if they've been exposed to COVID-19 or are experiencing symptoms. Residents who need a test can register at covidtest.gov.bs to be tested for free at one of our sites. Those sites are Kendall Isaacs Gymnasium and Melia Nassau Beach Resort in New Providence and Christ the King Hall in Grand Bahama. An update on masks. In an effort to ensure Bahamians have the right tools, again, to fight the pandemic, the government of the Bahamas continues its mass distribution of KN95 masks. Thousands of masks have been given out through our partners at the Red Cross, Great Commission Ministries, Hands for Hunger, as well as churches, government clinics, vaccine centers, and testing sites. Medical grade masks better protect people from the coronavirus, and that's why we're distributing masks to both children and adults. In continuing our push to ensure our children are safe at school, as this press conference would have taught you, we have delivered KN95 masks to the Ministry of Education this week. Approximately 80,000 masks were delivered to the Ministry of Education for distribution, and that represents 40,000 for adults and 40,000 for children. Some announcements coming from PM. Prime Minister Davis traveled to London this week, as you know, to meet with the Commonwealth Secretary General, and that is the Right Honourable Patricia Scotland, ahead of the Commonwealth Heads of Government meeting that will be held in Rwanda this June. Prime Minister Davis was among several political leaders to attend the meeting in Marlborough House, and there he continued to be an advocate for climate change, pointing out that climate change presents an existential threat to low-lying islands like the Bahamas, and the area needed to be tackled strongly is funding for these islands. He said, and quote, The process for accessing climate financing is tortuous, and that many small island states like ours have not been able to access what we need. So the voice of the Commonwealth of Nations needs to be a loud voice sufficient to bring awareness and the need for action, not tomorrow, but today, end quote. The Prime Minister, of course, will continue his advocacy for climate change at the upcoming Commonwealth meeting in June. And some congratulations. Prime Minister Davis received an honorary doctorate from Middle Tennessee State University last week, and I'm sure all of you will join me in congratulating him. During this trip, Prime Minister Davis delivered the commencement speech at MTSU's class of 2022. The honorary doctorate is the most prestigious degree conferred to recognize persons whose career reflects sustained, exceptional achievement in the fields of scholarship, public service, and other endeavors. The university has only conferred 5 of these in its 111-year history. And of course, some good news. We want to mention the 2 major events coming out of Grand Bahama. Firstly, the $1 million sale of the Grand Lucayan Resort. It was a great day for Grand Bahama and still is a great day for Grand Bahama, as yesterday the resort was finally sold. The new purchaser, Electra America Hospitality Group, also pledged $5 million to the Ministry for Grand Bahama's new unit, that's Collab Partnership. And Deputy Prime Minister and Minister of Tourism, Chester Cooper, said he was pleased to find a company that was not just an investor for Grand Bahama, but also a community partner. And of course, as we said, the good news continues today. Carnival Cruise Port officially broke ground. That $20 million investment by Carnival Cruise Line will create a projected 1,000 permanent jobs and countless more during the construction phase, and also that has implications for the entrepreneurs on the island. Prime Minister Davis this morning calls the project a positive sign that growth is coming to Grand Bahama. He also praised the company for their commitment to being environmentally friendly. And that ends our announcements for today. And if there are no further questions, then I think that we are going to end. Thank you so much for attending, and to all of you that watched, thank you so much.